Hello, everyone. This is our second episode of our Go with the Flow Walking Wednesdays. Really excited to have our amazing global walking therapy researcher of the year from Glasgow, Scotland. We have Dr. Chris Seenan, who is here to answer your questions about walking as medicine. As you know, our bodies are incredible. If you have PAD or you have CAD, and you have blocked arteries, your body can actually rise to the occasion and create natural bypasses. We're going to be talking more about that as we do every single time we do have a session with Dr. Seenan. I think it's important to start off every single episode really explaining your body's ability to grow these collateral vessels. But first, why don't we welcome Dr. Chris Seenan? Thank you so much for being here. Why don't you introduce yourself and also introduce a very special project, again, that you're working on that could impact care for PAD across the globe.
Thank you, Kim, and thank you very much for having me once again. It's great to be here and talking to you all today. So yeah, my name is Dr. Chris Seenan. I'm a physiotherapist and a senior lecturer at Glasgow Caledonian University in Scotland. I have an interest in my research interest is in peripheral arterial disease and specifically the experience of having intermittent claudication or that pain when you walk. So yeah, my research has been looking at developing and testing interventions or ways to help reduce that pain and help people walk further. Because as we all know, walking is one of the best things that you can do for when in this condition. So that's links to the study and the survey that Kim's mentioned there. We're doing a wee research project at the moment with some of our master's students in physiotherapy. And so we've got this, it should take around 10 minutes to complete. It's a survey that explores the experience of living with peripheral arterial disease and claudication with some generic instruments to looking at quality of life and function and kind of a bit about you and who you are. And with the aim of this being that if we know more about you, your condition, and how it affects your life, then we can maybe decide, we can work out what we need to do to help.
Definitely. So if you are on YouTube, make sure our amazing producer Joshua has put the link in the comment section. Go ahead. It takes 10 minutes to do the survey. It's really quick and it's going to help improve the care, I think, across the globe with more and more people having a greater understanding of your experience as a patient. So also, if you're here in the live studio audience on Zoom, go ahead and Dr. Chris Seenan has put the link in the chat. Let's get to your questions. If you are on YouTube, make sure to like our video. If you want to see more of these, like the video, subscribe to our channel, and we're going to find out. Stay tuned till the end because we're going to find out when Dr. Seenan is going to be back to answer even more questions from you, depending on his very, very busy schedule. But I'd like to jump right in and get to these questions. Post your questions in the comment section of YouTube or in the comment section in the Zoom. I want to get to Mike. Mike, I'm going to go ahead and unmute you. And since you were the first here online with a question, go ahead and unmute and ask Dr. Seenan your question.
Yes, good afternoon, Doc. Hope you're well. I've been walking properly for about 2 months, that's all now, because the consultant in Aberdeen Hospital, all he said was walk, but he didn't tell me how to walk. And I found how to walk on Kim's wonderful channel. So the question I want to know is how long before I'm walking properly will I see a difference in the time that the claudication comes on?
Yeah, very good question. So, great to hear that you're walking, and then great to hear you've been using some of the resources from Way to My Heart. And there is such a wealth of information on there that you can use. So, in terms of how long it would take before you can notice a difference, again, it's quite variable, to be honest. So some people might see a difference quite quickly, and when I say quickly, maybe in the space of a couple of months. Other people, it takes a lot longer. So I would probably be interested in hearing from the floor, because what we've seen in our practice, or in the studies that we've done, is some people might see a difference by the end of 6 weeks. Other people it takes 12 months. So I wouldn't like to kind of put a direct figure on it, because I think there's so many other things that might have an impact on it. So yeah, I'm not sure if anyone else would be keen to share.
Yes, I would love to hear the thoughts from the live studio audience. Go ahead and raise your hand if you want to share your improvement in claudication time. How long did it take you to start seeing any improvements? What are some tips and tricks that you may have? And yep, Kathy, I was going to call on you, so I'm going to go ahead and unmute you. Kathy, go ahead and share your experience.
Hi, I think that's a really good question, Mike. I was the same, and when I first developed PAD in 2006, I was already walking miles, and it was a big deterioration in my walking. So that was really hard because I couldn't see how I could improve. I could actually do less. I was walking miles and miles, and all of a sudden I couldn't do this. So it was very, very difficult, and I couldn't get the answers. I tried for years and years to get the answers. And now and again, I would have a burst when things would be going well, when I'd put some sort of extra effort in, kept all the cardio stuff going, but still couldn't walk. But I found that certain things helped, and in certain circumstances, and I tried to do those things. I still couldn't get my head around it. It was only when I had lost a lot of capacity, when a lot of things were going on in my life, and for a variety of reasons, we'd moved house, and the other leg had joined the party, and I was down to walking about 2,000 steps a day from about 15. And I thought, I'm going to have to do something about this. And that was when I got involved in a clinical trial that Chris was involved in. And I found out that all these clinical trials had been done showing how walking a certain way benefited. And I was jaw dropped. So then after that, I thought, well, I'm going to try and do this. And just about that time, I found Kim's page with Dr. Dua, who's a vascular surgeon, just giving a brief 10-minute explanation of what the principle of this walking was. And I thought, I'm going to give this a go. So I set myself up on the treadmill, and I timed it, and I did it, and I timed it, and I did it, and I timed it, and I did it. And it took 6 months. So when I started, I was walking, I couldn't walk more than 6 minutes on a treadmill at 1.6 miles an hour. And by the end of the 6 months, I could walk 30 minutes at 2 miles an hour, which I was pleased with, because that was all I wanted, was to live my life generally without pain. I wasn't looking to do anything, because I had a lot going on in my life that I hadn't got hours and hours to walk. I just needed to hit this 30 minutes. And in that time, I would say I've been up and down a bit, depending what's going on in my life. When I can give the time to it, it pays dividends. But now the way I look at it is, every step with pain is a step in your investment bank, basically. And then you can draw on that. As long as you keep it going, you can draw on that when you need to, when things get difficult and walking is more difficult for whatever reason, the weather, you have an injury, you just don't have the time. And I have found that over the years, I have not lost the ability to do this. Each time I've needed to do it, I've been able to step it up. So the collaterals are still in there. So I think that it's different for everybody. But I think the fact that I was very active when this was diagnosed was just devastating, because all it did was reduce my lifestyle. I took to a bike, that helped. But it didn't help with the walking, but it helped with everything else. Made me feel better, kept my cardio up, because I'm a heart patient as well. And I have to keep my cardio up. But now I find that it just, you have to do these steps with pain, but they don't all have to be in pain. And it's about getting that balance, and how much you're prepared to compromise, how much it matters to you, and also what other conditions you have, how old you are, what the weather's like. But for me, it was about 6 months. But I know other people who've made big turnaround in 8 weeks, 12 weeks.
I see Dr. Seenan, you're nodding, so you're in agreement.
Yes, absolutely. Thanks, Kathy. That's really interesting.
And Heinz, do you want to share just a little bit of your experience before we get to your question as well, and how your walking's improved?
Yeah, no problem. Right now I'm getting, I think, reoccluded, but previously when I had PAD, I could only walk half a block before the pain set in. It was excruciating to the point where, of course, I had to stop, rest, 3 to 4 minutes, and then continue on. After about 6, 7 weeks, I was able to walk 3 miles without stopping, 5 kilometers. And, you know, it hurt, but nearly not as bad as when I started. So yeah, it worked for me, which kind of brings me to my questions. I had 2 questions. One of them is, I found when I previously walked and I had the pain, I was starting, my posture was bad, of course, because I was limping and I was leaning forward and all that. And my question to you is, you know, I know limping is bad to start with, but what have you found with people with claudication and all that, related to, you know, because you're told walk till you get pain. Well, if you're limping, do you need to stop? You know, because it's already starting to get bad, but it's not bad enough where you really have to stop.
Mm-hmm. So thanks. Yeah. So is it in terms, are you asking, should you keep walking while limping?
Right.
Yeah. So, I mean, I think one of the best ways to think about this, I suppose, is what's the purpose of walking? What are you trying to achieve when you walk? And for me, there's 2 things. One is the kind of raising of your heart rate and testing of your cardiovascular system. And the benefit of that, of increasing your breathing, increasing your heart rate, is to kind of keep you cardiovascularly fit and prevent the other complications that might happen as a result of PAD, for example, heart attacks or stroke and things like that. So that's one reason. The other reason is obviously to train your muscles and build these collateral vessels. And so that both happens at the same time. So as you walk, your muscles get exercised and they get trained, they get stronger, they work more efficiently, and therefore they require less oxygen from the blood to work. And then at the same time, you grow these collateral vessels, which help supply even additional blood to the area. So if you're walking while limping, it's fine for that would still obviously increase your heart rate and increase your breathing and train your cardiovascular system. So it's still useful to walk while you're limping. And then for the second point, in terms of training your muscles, if you're limping, yes, you might not be using your muscles quite as effectively as you were when you weren't limping, and your posture might have changed. But as Kathy, I think, just summed it up there from Dr. Dua's video, it's like every step in pain is an investment, and you will be kind of helping to build those collaterals if you're walking into your pain as well. So I guess the bottom line for me is, don't worry too much if you're limping or if you have to change how you walk. If you can keep doing the steps, it will be helping you.
Well, related to that, you know, with limping, you're doing damage to other parts of your hip and things like that. That's why I asked that, you know?
Right, okay. I mean, I don't know if I would agree that you necessarily are doing damage by limping while
It
walking. I mean,
hurts.
so it does hurt on other places, right? Okay, so
Yeah.
then that is probably when you can, I guess, figure out, why is it hurting in these other places? Is it because, is it a different force that's going through? Is it you're kind of testing some other structures? And yeah, if that does mean that some damage is occurring in a different place and that hurt continues after you stop walking, then yeah, you need to be careful about how you're doing that walking. I understand the question a bit better now. Thanks.
Okay. And with that, I had a second question I posted yesterday. How does lactic acid fit in all this with intermittent claudication and PAD and things like that?
It is a key component, and that is basically how we understand the pain is generated in claudication. So what happens is, as you walk further or up a hill, or your muscles need to work harder, they require more oxygen to kind of maintain their metabolism. If you're not getting enough oxygen to the muscle, it changes from what we call aerobic metabolism, where you're using that oxygen to help kind of create the energy, to using other substances to create that energy within the muscle. And one of the byproducts of that anaerobic metabolism is lactic acid. And what is thought is that as that lactic acid accumulates or gathers in your tissues, it reduces the pH, or the kind of makes the tissues kind of more acidic. And it's that acidic nature within the tissues which sensitizes the nerve endings and provides that feeling of pain. So yes, it's that lactic acid that contributes to that perception of pain, but having lactic acid in your tissues is very normal and not necessarily a negative thing. It happens. It's the same. It's why you get pain after exercising in any condition. It's that buildup of lactic acid that comes from that anaerobic metabolism. So it's not something to worry about.
Okay, thank you.
Thank you, Dr. C. And thank you, Heinz. Alan, go ahead and unmute. And first, go ahead and answer Dr. Seenan's original question, which I think it's just our question du jour, right, for the day, which is about when you first started seeing improvement based on your walking, so we can help Mike out just a little bit to understand other patient experiences.
Yeah, that's what I wanted to share. I was diagnosed in February, and within a couple of weeks of being diagnosed, my daughter had found Kim's website and support group on Facebook. And so I learned very quickly that I need to walk to help myself. And when I started, I had a hard time walking 1,000 steps. It was very painful. But I started pushing myself and walking to induce claudication. And probably within 3 or 4 months, I was able to walk 6,000 steps. And now I can walk 6,000 steps without feeling a lot of pain if I walk at a leisurely pace. If I really walk at a brisk pace, then I'll still induce claudication. So I mix it up. Some days I walk at a leisurely pace, some days I push myself. One thing I want to point out is you go up and down all the time. You know, I'll go out and have a day and I'll easily walk 6,000 steps. And then the next day, for some reason, I have a hard time walking 4,000 steps. And I don't know what causes that. It just goes up and down and up and down. And so don't get discouraged if you've made some progress and then all of a sudden you have a really bad day. Don't let that discourage you. That's going to happen. And I have a feeling that's going to happen for the rest of my life.
Dr. Seenan, do you care to comment on that fluctuation that these patients experience?
Yeah, thank you. And thanks, Alan, for sharing your experience there. That variation is unfortunately so common, and that is what we found in all of our studies. And it's interestingly the one of the key challenges we have in almost proving what works, because if you can imagine, often what we try to do is you measure someone at the start, like before you do something to them. So and you say you can walk 100 meters, and then you do something for them, give an intervention, and you measure them afterwards to see, has this made a difference? Quite often at the end they might only walk 50 meters, or some people can walk 150 meters, and so on and so forth. And what that variation, that change is often just, as you say, as Alan's saying there, just because it's a different day. It's different weather out there. It's incredible the amount of different things that affect this pain experience, and therefore the variation you'll experience day by day. I think one of the things to pick up, and I think it was Kathy that indicated that earlier, was the more you can almost measure and notice about your progress, and even if you can record it somewhere, often I think people find that really useful, because then what you can do is you can see trends over time. So you're not just comparing one day to one day, but you might be comparing, 30 days 1 year ago to this 30 days that you have now, and you can kind of plot an average rather than looking at the variation between day to day. And when you look at that average over time, what you generally see is there's a bit of a difference, and that's, hopefully I can tell that's what you're feeling there, Alan, where you're in general you're walking more steps per day, but it might be you might experience more pain on some days than others.
If you go to info@padhelp.org, you can let us know that you want to sign up for our specific PAD walking app. and it allows you to track your symptoms and your claudication time that no other app can do in that way every single day. So happy to get that to you, but we have to sign you up. You can't just download the app. It's only available on iPhone today, but in a couple of weeks, we are getting approval for Google Play, so it'll be for the Android as well, fairly soon. But you can go ahead, info@padhip.org. Let us know you sign up. Let us know what type of phone you have, and if you're ready for iPhone, we'll get that in now. And if it's Android, we'll put you on our list to notify you in a few weeks. I want to get to Dawn. Dawn wanted to comment on our question as well. Dawn, go ahead and share your experience in walking as medicine for PAD.
Well, hello. Yeah, actually, you said about that about the Android phone. Indeed, that's why I haven't been able to use it, because I have an Android phone. Yeah, actually, so Chris, there, I understand you're a physiotherapist, and I actually wanted to share with you my experience of dealing with the physiotherapist. I live in the Netherlands, so don't take it personally. It's how they do it here, right? And but of course, most people with this condition are a lot older. I mean, I'm not very young, but most people are a lot older than me. And to be honest, what I found was after my 6 months of physiotherapy, which they gave me, it all felt really, dare I say, kind of patronizing to me. And that's because, much like Kathy, I was like I would hike all day. You know, I'm walking in the mountains, not here in the Netherlands, but you know, in Ireland and stuff. And that was my thing. That was my pleasure. And then to be told from the fella there, yes, you know, I've got someone who now we can walk 1,000 meters to church. I'm like, well, big deal. I don't care. I don't care, because I want to be able to walk all day, because that's what I did before this happened, you know? And so I wasn't very satisfied with this, but I did the physiotherapy, and I was there on the treadmill, and I'm quite tough. So I was just there with just gritted teeth the whole way through doing it. And indeed, in terms of the figures, they would say it's made an improvement. But in myself, would I say I feel better? No. You know, basically walking hurts and just never stops hurting, you know, and I never ever, I have still not back to the pace that I used to walk at. So what I did find was useful, though, it wasn't from the physiotherapist, it was the surgeon. I just said, look, you know, can I make it worse by what I'm doing? And he said, no, you can't make it any worse. And that for me actually was like, right, okay, it's going to hurt, but I don't care. I can't make it any worse. And what helped me more was, because the thing is, the walking is frustrating, because I used to walk fast, I used to walk far, and now I can't do that. So I find it annoying, you know? So I need to do other things that make me feel better. And I've discovered the gym, and I've discovered a personal trainer, and I do workouts twice a week. I do circuit training. So not all the exercise on my leg, but I'm like super strong now, and I can do all sorts of bench presses and things. You know, I love it. I absolutely love it, you know? And that, though, has made my legs stronger. And in fact, that's of course improved by walking. Right. So I suppose my message to you and everybody in the profession in general is that yes, walking is the exercise, but it's not the only exercise you can do. You know, and perhaps if you're older or less mobile anyway, the walking is enough, probably is enough. And if you're satisfied with that, it's grand, you know. But if you're used to being more active, just being told just walk, just, you know, struggle around the block, you know it's going to hurt. It's just not fun. It doesn't make you feel great, you know. Whereas I go to the gym and I do lots of sit-ups and bench presses and stuff, and you know, then I already feel more motivated to step on and off the bloody boxes that I have to do there a lot, you know. Right? And I don't mind it, because I come out of it feeling better, much better, and I can walk, in fact, a lot further than I did, you know.
Yeah.
So anyway, that's my my up and sport there really on this.
Thank you, Dawn.
Yeah, any comments? There was a lot to comment on there. There's so many different things, such as even going to the gym to strengthen your legs, so that also getting more muscle in there can help you to improve your claudication time as well. So the next time, if you're strengthening your legs, you know, by going to the gym, then you go out and walk. That can help, right?
Right. Well, that's it. I mean, geez, when it was very bad, so when this really started 2 years ago, you could see the muscles in my bad leg atrophying. It was visible. It was visibly smaller than a good leg. It was shocking, you know. And now it is slightly smaller, but not that you'd notice. And I'm like, that's great. That's from going to the gym and doing squats and everything. Yeah.
That's
So, and
fantastic.
yes, indeed, Kathy, I do cycle a lot as well. Yeah. So anyway, I said, Chris, the point was there's more than just walking, you know, to get the result you want. Yeah, sure.
Yeah.
Anyway,
I think
it's all good. Thank you.
Thank you, Donna. It's really interesting and useful to hear your story there. I think that's such a important message to everyone because I think it's something that it can get people incredibly down when they're just told, just go and walk, and it seems like they're being
Just
brushed
walk.
off or patronized or
Yeah.
dismissed.
Just walk. It
And
hurts. I know it hurts.
yeah, I
It's just
know.
like, this is not
Yeah,
fun. This is not
yeah,
motivating.
yeah,
It's just me like
absolutely.
this on the treadmill.
Mm.
That's not life, is it?
No, that's horrible. And absolutely, I would really advocate for the approach that you've taken and just finding something work out what's important to you, what matters to you, how are you going to achieve that and do it because it will be different for each and every one of you and each and every one of us. And um, going back to that, thinking about what are the reasons I am exercising? Why am I doing this? And as I mentioned before, there's that cardiovascular benefit, but there's also the walking distance benefit. And for you, it's clear that but the good thing is that they can both help each other as well as what
Aye,
you've
indeed.
found.
It's not one or the other.
I
No.
absolutely. And walking is not it. Walking is often what we recommend because it's the easiest, it's the cheapest, it's the most
Mm,
accessible, it's the kind of simplest thing to say, and that happens to be what the research evidence has looked at most commonly. But there's evidence of cycling, there's evidence of strength training, there's evidence of going to the gym. All these things work. So please figure out, and cycling as well, figure out the thing that you want to do and do that. And the other thing I would pick up on what you said there, which was so important, is that bit about no harm. You are not going to hurt. You cannot make this worse in your legs by doing it. And that is such an important thing, I think, for everyone to understand, because there's such a lot of fear associated with this condition about what's going on in my tissues, what's actually happening in my legs. And I think to have that confidence to know that, oh no, I can push this, I can do different things, and it's not going to make this worse is really important.
yeah, that helped me
And
a
I
lot.
think
Just that thought, like, okay, I'm going to keep going. I can push through all of it. I'm not going to hurt myself anymore. It's like, okay, go then. Right?
Yeah.
Yeah.
but there is still, as Don, we talked about before, there's still that point where, you know what, if walking is not improving your pain, it is time at that point, and it's affecting your lifestyle. It is time to talk to the doctor about other options, to interventional or surgical options that might be right for your situation. So it
Well,
might be a
yeah,
sign.
well, actually, indeed. Yeah, indeed. I do get it. Like, for a lot of people, it is, well, not, no, no, maybe some people, it is lifestyle based, this, right? So it'll be things they've done in the past or whatever that's affecting their system now. And in other people, it's just unlucky. And I seem to be one of those people. Um, But yes, indeed, I am lined up to have a bit of an operation now as well, Kim. Very scary. And but basically, the surgeon has said now, he can't fix all my problem. It's completely blocked. It's a total disaster, actually. They can make it a wee bit better. And I said, what can I do before for the operation? He said, get as fit as you can. So I'm on a mission, right? I'm not,
Uh, good
that's
job.
it. Yeah, yeah. So,
That's so true. The only point of these procedures is literally to give you that much more blood flow to get you out walking to grow those collateral vessels. They're all going to fail. None of them are perfect, but the whole point is, doctors are willing. If you're willing to help yourself, you're willing to try. Get out there and
well,
try. And then if that doesn't work, then they're just going to give you just that much more blood flow,
just a
just
wee
so
bit
you
more.
can.
I'd be so grateful. I don't even want all of it anymore. I'm like beyond that now. I'm like just a wee bit more. Indeed. Although, actually, interestingly, Kim, now can't remember exactly what they got to call it, atherectomy or something, where they
Counteract.
open up a bit of it. And the surgeons, because I said, like, how long does it last? And he said, well, the evidence is 10 years, but he said most people who have this are much older. So actually, they don't have the evidence for anybody younger. And when he said he looks at all my stuff and all my other arteries are fabulous, I've only got one bad leg, everything else is grand. So he said, actually, for you, Dawn, it could last a lot longer because there's no reason something weird happened for it to block and they don't know why. So actually, it could be a long
It,
time.
it
I
could
don't
be
know.
exactly what you need. And so we're all pulling for you. And I,
Thank
I
you.
do want to make a point, Dr. Seenan, and I don't know if you agree, but we see in the chat that people are talking about other things other than walking. And Kathy's mentioning that cycling, while it's blissfully pain-free, what do you think about the indicator? Okay, great. Go do all these other things, do water aerobics, do cycling, do what else makes you feel good. But then if you're not seeing your walking in day to day and your lifestyle improving, then maybe you just have to stick with that walking and push through that pain and focus more there. What do you think about, yes, great, all the other exercise, but if it's not improving your day-to-day walking by doing all those other things, then maybe that's a sign you might need to just suck it up and walk.
It's difficult, I think, because it will be very different. Again, it seems a bit of a cop-out, but it's different for everyone, and everyone wants a different thing. So for some people, and I guess it sounds like that for Dawn, that it depends when the pain's coming on and how it's affecting the daily life. So some people, and it also depends on what the pain means for people and how it affects them when they feel it. So for some people, really, don't mind the pain and will walk through it and don't find it too bad. Other people, experiencing that pain is just the worst thing they can do, and so they would want to do things to avoid it. So again, I think it's very much think about what are you trying to achieve? What's your personal goal? What's important to me? Is it do I want to walk pain free, and therefore you will need to do work on things that are going to help reduce that pain, and often it might be recreating the activity that brings on the pain to walk to go a bit further and build those collaterals, build that efficiency in the muscle and get further. For others, it's I want to stay fit and healthy and I can do other things to achieve that. And as Dawn's saying, then if you do your circuit training, your strength training, you can, I don't know, Dawn, do you experience pain while you do your circuit training, or is it
Oh yes. Oh yes.
So
yes, I do. But yes, I do. So in not all the exercises, and that's what gives me the buzz, is I can do other exercise and get fitter without the pain. But yes, absolutely. If I'm doing cardio exercises for any extended time or leg exercise, absolutely. Yeah. And so then no, I'm still doing a good thing. And Kathy's right as well. Cycling is pain-free if you're going slow and on the flat, right? As soon as you start going up a hill, it's not pain-free. So you are still building up your muscles here, right?
Yeah.
So it depends what you're doing, doesn't it? If you want to push yourself, you can. So yeah, indeed. I live in the Netherlands. It's pancake, right? So if I'm going to the shops, I would cycle because it's like, oh, it's nice and relaxing for me. I just whiz over there, it's no problem. But if I want to work out, then I will go on a route where I go up into the hills. There are a few hills here, and I will go up in there. And then that's more of a workout. And then you can feel the legs burning. You can feel that they're struggling, but that's okay because that's what you're doing at that moment. I think the thing is also about everyday life, isn't it? If I'm working out, I don't mind that it hurts because I'm working out. I don't want to be in pain when I'm just trying to do my job. I don't like that. I shouldn't be struggling to walk around all the offices I have to walk around. I shouldn't be in pain doing that, but I am sometimes. So
that's a good point.
Thank you, Dawn. And I want to get to Guy. Guy, go ahead and unmute and ask your question to Dr. Seenan.
Hi, everybody. I'm new here, so it's sort of a bit daunting to me, to be honest with you. I've not long been diagnosed, and listening to some of the conversations, I didn't actually know half of this stuff because my GP's not even. I had no idea that your symptoms could even be improved. So questions, so many things, so many questions I've got. But I suppose the first one is: so can walking actually reduce your symptoms or even reverse the disease? Is that possible, or does it just prevent it from getting worse?
I think the way I would conceive this is that, and it will depend on your disease and where it is and what's going on. But no, your walking cannot reduce the blockage necessarily. Right. But what it can do, as I say, is change other things that make the experience of the condition a little bit less. So it will improve the efficiency of those muscles and mean they don't need quite so much blood getting to them while they exercise, and also grow those collateral vessels around where the blockage is and help hopefully improve the perfusion.
Could I just ask you about growing those collateral vessels? Because again, I didn't know that was a thing either. So could you just explain the basics of that.
Yeah. Well, I think there's a video on the website, which Dr.
Okay.
Dua's video is much better. Will explain it much better than I will. But I think the general principle is, if you imagine your main artery is like the motorway, and there's a traffic jam on that motorway, and cars are all backed up. The idea of the collateral is the body, when it senses that, and that's why walking into pain gives the body that signal that there is a blockage there, that it then starts growing these smaller vessels around. So it's like the B roads that will go around. So you would come off the motorway, go on one of these B roads, and then rejoin the motorway past there. And that's the idea of the collaterals, is that over time that you will get this bit of growth. It does not replace it. They do not carry as much blood as the main artery, as the main motorway will, but it can help.
Okay, thank you. And the next question, I'm a bit similar to Dawn. I mean, I've not long been diagnosed, and I haven't yet seen a specialist, just GP. So I'm just on statins and blood thinners. But like Dawn, I was previously quite an active person, and so my walking's reduced, but I still keep it up. I try and do sort of 40-minute sessions, like 4 times a week on average, I would say. And I've always been a fast walker, so I like to walk as fast as I possibly can. And then I've only learned what I've picked up from the web so far, and that so I've been walking to sort of 90% of the pain and then easing off a little bit. But whenever I get back from a walk, I do check my blood pressure in my leg, and it's like 68/50 something normally. And at the moment, I've no idea whether that's like, is it safe to carry on walking at that speed, or is that sort of dangerous?
Yeah. In general terms, it's as Dawn indicated, it's safe. There's not going to be any harm with the walking. What you need to be careful of are the additional things, or the kind of warning signs that the blood supply to your feet or your legs is getting to a dangerous point. And what those are when you get if you have a small cut or blister on your foot or your toes, and it doesn't heal very well, or you get the kind of any of the skin kind of starts changing color quite considerably, then those are the times we need to go and see a specialist and get it checked out. Even still, it might be fine, and they might still say, no, you're okay, it's everything's. But the importance is that that they're the kind of things to worry about.
And so I've got quite a high pain threshold. I keep trying to walk through it, and because I'm determined. But it's like, can I just keep increasing the amount I walk even when it's still painful? Like, there's no, literally, I can just
keep
if
going.
I want to go and walk up a mountain, I can just do it.
Go for it. Yes. Absolutely, and as Dawn indicated, it will help, and but you don't have to do, as I think other people have said today as well and before, not all your steps have to be in excruciating pain. But if you do a substantial amount per week in that pain, then you should be seeing some benefit.
Okay, thank you.
He is asking, she doesn't understand why you need to completely stop when your pain does get bad enough. Why not just slow down at that point? And I think that's a good question, but it's one of those things that when we talk to our patients, and I'm curious your thoughts, Dr. Seenan, Dr. Dua says it doesn't do you any good to just slow down. You got to maintain that pace. Stop for a second, let it relieve, and get back to that same pace again and push it. And she said that's the way to really accelerate those collaterals. But I'm curious your thoughts, if you can explain it.
Yeah, I mean, I would agree to an extent. I think the problem is we don't have the evidence to comprehensively prove one thing or the other necessarily, that you need to have that X amount of level of pain means the collaterals are growing, or this amount of pain doesn't, because we haven't done those studies yet to really prove that. But what we do know is you need to be walking. The more you walk into pain, the more you walk nearer to your maximum amount of pain. That's when we've seen the best results of this kind of collateral growth. So I think that. And again, I would always go back to think of your two mechanisms and the reasons and the rationale of why you're walking. So one is this collateral growth and going further without pain, but the other is for your cardiovascular health. So if, and so if reducing your pace enough so that you're not in excruciating pain, but you can go for another 30 minutes at that pace, you will get loads of benefit from those extra 30 minutes in terms of your heart and your lungs and your rest of your circulatory system. Although it might not be helping your legs quite as much, but they are as important as each other. And I think that's an important thing to pick up from your first question, Guy, is that unfortunately this is a progressive condition. It is not one that goes away. It's something that, and it is the way that PAD, if you have general PAD, and I can't speak for everyone here again because you'll have different experience of this, but generally peripheral arterial disease is happening. It's this, the furring up, the clogging up of your arteries, and it's happening all over your body. And it just happens that you're feeling it most in your legs because they're the ones where your muscles are working. So you need to have that cardiovascular fitness to help kind of hold back that process of the development of this atherosclerosis.
We just have, it seems like 3 more just questions. Marie is asking, she says her ABI is at a 0.4 and she doesn't really have pain in that leg. Is it okay to just not have a procedure? And is it possible to walk out of that 0.4, which is CLI territory?
I'm not sure about walking out of that territory, but I would suggest that walking works at kind of all stages of this condition. And that as I'm just risk of repeating myself again, I think when you're at that level, even though your leg might be occluded to that degree, you still need the walking to help with your cardiovascular health. You need that exercise. It's almost no good. If you have a procedure and it clears the blockage and your ABPI gets better, it doesn't mean you can just stop your exercises because you don't have any pain. You still have the condition. The condition's still developing, so you need to keep up that level of physical activity to maintain your general health.
And I think your answer to this, you've already pretty much, answered it. But, Heidi is asking, she can't walk outside in the winter here other than her treadmill, which has no incline on it. What kind of indoor exercises would be the next best thing that benefits PAD in addition to walking on the treadmill, and how much of it and how long each and every day?
It would be hard to kind of give a specific prescription for you, Heidi, without kind of knowing a wee bit more about kind of your condition. But I would say anything that is exercising the muscles that are where you feel pain. So things like steps. So if you've got a set of stairs in your house, up and down those stairs where you're really using your calf muscles and your leg muscles to push you up those stairs will help. As Dawn is demonstrated again today, like circuit training, doing squats, doing push-ups, doing sit-ups, any kind of exercises again that are using these muscles, raising your heart rate will be doing you good. So I think it's about finding something you enjoy doing and that you can do and will do, because that you can have the most wonderful exercise regime in the world, but if you're not inclined to do it or you find it difficult to do and you don't do it, it's the worst exercise regime in the world at the same time. So the best exercise is the exercise you do. So just do something.
Good point. And Jolita is asking just in regards to just how far she should really push herself. She said she gets to a point of pain when her blood pressure actually spikes and she starts to feel a little nauseated. I think that's kind of, you got to draw the line before that, I would imagine.
Yeah, and you got to be safe and you got to be careful with yourself. So yeah, I mean, use the normal things that we do when we're getting someone to start up a new exercise regime. Make sure you get yourself checked over by your physician or your doctor so that you know that you're safe to exercise and to push yourself. And then if you do start feeling any other symptoms, like if there's any kind of dizziness, lightheadedness, if you get unusual pains or experiences, then stop and get yourself checked to make sure you're safe at all times.
When Tony says that he's, over 2.5 years, he's reduced his symptoms by running, he wants to know what exactly is happening. What is happening exactly for this to actually happen? Do the collaterals increase in the number of size, or length or what actually happens during the process?
It's a really good question, I think. And what you would need to do is get an ultrasound or kind of imaging of your muscles of your legs to kind of find out what's happened for you. So it can, I think what I've kind of most commonly heard is it's the number of collaterals that grows rather than necessarily length or diameter or anything like that. But as I'm mentioning as well, the it's the efficiency and the health and the strength of the muscles that helps as well. So almost even if you didn't grow a single collateral, if your muscle becomes more efficient, so you think about it as as an engine, if your engine's working really efficiently, it requires less fuel. And that fuel is the oxygen from your muscles, from your blood supply. So if your muscles are really efficient, they require less blood supply, less oxygen, and therefore you experience less pain. So it could be that as well, or a combination of all of these things.
And I think this is the final question, unless there's someone in the audience that wants to raise their hand to ask another question. This is the last one I'm seeing online coming in here from Amy, who has a blockage in her left SFA and another in the right iliac. When I walk, I get severe cramping pain in my low back, hips, and buttocks. Is that likely claudication or symptomatic of degenerative spine issues, which have also been diagnosed, or is it a little bit of both? And she says, I don't want an intervention unless it's actually needed, but it's really starting to affect her ability to walk effectively. And she just doesn't know what's coming from what.
Yeah. Again, it'd probably be hard for me to work out from at a distance, but so I think go and talk to your healthcare professional to kind of find out with the way in terms of, is it my back or is it claudication? The key thing that would normally determine between one pain and the other is that the claudication pain generally, as you all know, comes on when walking, when exercising, when pushing yourself, whereas pain from your back can come on just due to position or posture and things like that. If you're in a certain position and you haven't even been exercising. So if the pain's coming on without exercising, probably more likely back. If the pain only comes on when exercising, possibly more likely claudication.
Looks like we have one more for me in studio audience, if we have one sec. Vanessa, Lynn, do you want to unmute really quick and ask your question?
Oh, hi. Sorry about that. I had to find it. The doctor, I think, pointed out that the claudication that we feel in our legs is a sign of narrowing and a sign of peripheral artery disease. And in fact, yes, that was diagnosed for me back in February. But what I wasn't told was that it was likely that I would have narrowing in other parts of my body. And in June, I had an angiogram after a CT scan, and it was discovered that I had a narrowing in my left anterior descending artery of my heart, quite a severe narrowing. And I had to have a stent. And that I just don't think that we have enough information at all about this disease. Is there any pathway in the UK for people that have been diagnosed with peripheral artery disease at all?
Yeah, I suppose I'll deal with those two parts of your question slightly differently, I think. So first of all, I would say in terms of PAD, if you have kind of classic or a standard presentation of PAD, peripheral arterial disease, and that means kind of it's come on from risk factor, your general cardiovascular risk factors. Yeah, it's accurate, yes, that you know, even though you experience it in your leg, this narrowing of your arteries is happening all over your body in all different. And so yes, or if you have been diagnosed with PAD, you should, your GP, your doctor should kind of be keeping an eye on other systems and structures, and it's obviously really very important. in terms of the pathway for this, yeah, this is almost where the care where the system falls down slightly, is because certainly in the UK NHS that care is organised kind of by problem. So, you know, you go to see a vascular specialist and they are absolutely the best people to see about vascular issues, but then they often don't specialize, they're not a cardiologist, and therefore if you have it, they might not be paying attention to something that goes on elsewhere. So that's one of the things we're working on as a group at the moment, is trying to change the way the healthcare is organised so that we don't just kind of separate the systems out and only look at one thing at a time, and that you should be getting a review for your whole kind of cardiovascular system if you've been diagnosed with any one of these things. Because it's the same, other people that might be diagnosed with a heart condition often have PAD, but they don't know about it because nobody's looked for it. And vice, you know, so it happens both ways around. I don't know if that helps, Lynn.
Well,
No, it doesn't help, but it's good to know.
It helps a little bit, but it's just I
Oh, I lost you there.
You unmuted yourself. If you need to unmute, you muted yourself. Where did she go? Lynn, you muted yourself.
I was just saying, it's just that, like, for people like Guy, who sounds like his experience sounded like sort of the same as mine, really. And then, you know, we're told not to Google, and thank goodness I found Kim's group, because some of the things that I was reading were so frightening. But, you know, you feel like that's the only thing you can do, because you need to find out about, you know, I mean, I had to refer myself to a vascular consultant through private insurance. My GP didn't, you know, my GP didn't do it. My GP just said, yeah, you've got peripheral artery disease, walk. You know, so I just think I would be really interested in and I'm sure Kathy would, because she's very knowledgeable about this, in helping to work on any pathway at all, you know, if it's needed.
Yeah. Yes, please, is the general answer. I think.
Yeah, I'll put my hand up for that. You know, I just think anything really to help other people that are in the same position. But thank you.
I think Guy's also nodding as well. He agrees that that's exactly what he wished, and you probably hear it all the time, Dr. Seenan. We hear it here as well. That they just say to go walk, but interesting. I don't think that it's that they're deliberately brushing you off. I don't think that most know that there is an effective way to walk, because I'm here at a vascular conference in it's Viva, and it's in Las Vegas right now, and I've spent the last 2.5 days learning the latest treatment options and what's new and what's next in case walking fails. But I'm around here and I'm just saying, hey, no, we have a walking program. Let's really, the reason these people are ending up with more procedures is because at later stages is because you're not telling them how to walk. And I actually have had 6 doctors who have said that, and I'm not sure who's sharing their screen right now accidentally. We want to take that off. I'm not sure. There we go. I don't know what happened there or how the screen got shared. Sorry about that to everyone. But 6 of doctors here, you know, vascular surgeons, interventional cardiologists, interventional radiologists, and each one said, oh, you mean there's a way that people have to walk? I said, yes, there's an actual proven method, in a sense that you need to tell the patient to walk through the pain. And that's, oh, really? I just tell them that when they start feeling pain, just to stop and rest.
Yeah.
I said, maybe you might research.
It's so frustrating. And I think that is the other thing that we are trying to work on at the moment as well, is there's an aspect of educating the public and kind of increasing awareness of this as a condition and what it is and how it can be treated and what works and what doesn't work. But there's also we need to educate healthcare professionals Because as you were all explaining and noticing that so many healthcare professionals, because they are members of the public as well, just don't really understand it. It's PAD is not called the Cinderella disease for any reason. That is exactly it. It's the kind of forgotten cousin of cardiovascular disease, of like heart disease and stroke. Everyone knows a lot about those things, but not very much about PAD, and they always present in a very similar way. So yes, and this goes back to what you're mentioning, Lynn, there, and how Kathy has helped us so much. We need the patient perspective. We need patients to be telling us what we should be looking at, how to look at it, what their experience is, so we know what the problems are and we can start to hopefully address them one by one.
I think a great way to end this session is with Marcia, she's been walking this entire time, I think on a treadmill. I think you're you're inside. And she's actually done a great job improving her symptoms through walking is medicine. Marcia?
Yes, hi, thank you, Kim. Thank you, doctor. My question is the role of diet, not so much diet, but eating and when you eat and walking. So for example, yesterday, I try to walk every day, and get at least 10,000 steps in. But yesterday I had a lunch invitation. So I went to lunch and I ate a full lunch, and then I went to walk. And I had no mojo at all. My leg hurt more than usual. And I ended up walking a little bit and I went home. And I was on a trail. And then later in the afternoon, I did an exercise video and I crushed it. And it almost feels like when I eat, I can feel it going through not just my body, but my arteries. Or if I slip and have sugar, it burns. And yes, I see Kathy kind of agreeing. And so I'm wondering, I guess, are there any studies on that? Or what do you make of when you eat and when you walk?
That's a really interesting point, Marcia, and it's something I actually know not very much about. I'm not aware of any studies on that, but I think that it sounds like that is something we should look at or find out more about. So yeah, thank you. That would be
and it's
really
not just
interesting.
like, how people talk about an afternoon slump. It's not that. It's like almost immediately I can feel it going through my body and my leg hurting more.
Very interesting.
Thank you.
It is interesting. When she mentioned the walking videos, we had a patient that said those walking videos that are out there where they're just going to walk in place and such. Is there anything to those do they have the same impact as just general walking, do you think? It's mostly walking is dancing. They have these videos that are online on YouTube
that's what I do. It's a walking and dancing thing.
Great. I'm not aware of that, so I'm going to go and have a look at that myself. Yeah, that sounds great.
Yeah, doesn't it? Thank you so much. We can't keep poor Dr. Seenan here longer. We're usually trying to do these for 30 minutes, and now we're at an hour, but we appreciate your time. And what we had a question here about massage. Is it bad to have a leg massage? That's really up to we always say ask your vascular doctor, depending on your condition, depending on the type of massage that you do. It's really I don't know.
So what if you don't have a vascular person to speak to ask that?
Yeah, I think hang on until you've had that proper kind of consultation to
one of the things that I've had, because here in the UK particularly, so I've been told the waiting list to see my vascular consultant is 18 months. So in the meantime, I want to do what I can to help my symptoms and to prevent things from getting worse. And so, things like massage or physio or any other thing whatsoever, like groups like this are invaluable because it's the only place I get to actually talk to somebody.
Yeah, I'm finding that you're absolutely right. That's why they're so important. It's so great that Kim and everyone else has created this community. But I think that you're absolutely right. It will be a bit of a wait until you be able to see someone. I think the key thing at the moment is to focus on things we know, which is the walking. there is no evidence that physio or massage or anything like that necessarily helps. It's very much about the other forms of exercise that we've been talking about today, the strengthening, the bike, the walking, anything else that you feel you want to do and you can do. So I would focus on those.
Okay, thank you.
Here for you. You make sure, and I think we can put the walking group. We do have a general walking group you can join as well and ask questions every single day. And Dr. Seenan and actually some of his fellows are actually in that group as well, and they jump in and try whenever they can if they see their name to answer questions as well. They're really supportive, and Kathy does a really great job of helping to facilitate as well. If she sees your question, she tries to help get it answered as well. She has a lot of experience in working with their team. So we're always here for you, whatever you need. And we will get you some of those other videos that I think are very helpful as well. And also usually on Tuesdays, we have a podiatrist or a vascular specialist as well that can come on and answer some of your additional questions. We have a podiatrist coming on, world-renowned podiatrist from Italy that's going to be on in a couple weeks on a Tuesday. So we try to vary where the doctors come from around the world, so everyone has representation, someone from their area to answer their questions that are relevant to them. But again, thank you so much, everyone, for joining us. Dr. Seenan, I don't know if you're ready right now to announce another date that you'd like to join us again and continue these discussions. We still have so many more questions that keep coming in. So it's going to be up to you in your schedule. We can either announce now or again, people can like this video, subscribe to our channel, and they will get notified when the next session will be.
I would just say that I am not able to do it next week, but the week after would be suitable again at the same time. If this time is suitable for people, then 4 o'clock on the 20th of November might work for me if it works for others.
Yep, I think that'll be great. We really appreciate you, Dr. Seenan, taking your time and donating your time for this.
Oh, I find it so useful myself. Thank you.
Yes, definitely. And I think that what really worked this time, and what I was really excited about, is if we have a question that we can ask each time of people with PAD, and everyone who has a question will ask them that same question and put it out there. And I think it really sparked an amazing discussion. And a big thank you to Guy and Marcia and Lynn and Mike and Dawn and Heinz, and I see even Jean's here, and Alan and Kathy, and Tammy's here, and Janet, oh my goodness, and Nancy, everyone here. Thank you for your participation. We really appreciate you guys being here. Make sure if you have not done the study, there is a link in chat on both YouTube and in Zoom to participate in a study that really stands to help improve the understanding of the experience of people with PAD. So make sure and grab that link. Takes just 10 minutes, and it truly will help Dr. Seenan and his team conduct greater research that can help to hopefully improve the care for PAD in the future.
Thank you. Yeah.